Let's go. Sorry. Or let's introduce myself. I'm Yamile. As curiosity, Yamile is a feminine and Spanish version of a masculine Arabic name, Hamil. So you can see that there are some variants for my name. I could kindly respond to any one. I was born in Cuba. This is a beautiful tropical island. And I graduated there from biochemistry. And I also have a PhD degree in health science. After that, I moved to Mexico 10 years ago in 2013. And actually, I am a Mexican citizen. Apart from the beauty, the culture, and the exquisite variety of food in Mexico, I love Mexico because I began to work with Metabolomics for the first time there in 2017. My present aspiration is as researcher, professor at the Autonomous University of Zacatecas and National Council of Science and Technology. And as you know, I am doing my sabbatical here in this fantastic lab until February 2024. So having said that, if you have prepared a tasty, healthy, aromatic, or delicious cup of tea, as Claudia showed us last week, let's enjoy it with this brief presentation because we will be talking about babies. And yes, my life completely changed 22 years ago after my gorgeous first and only baby was born. It has been a beautiful and long process full of experiences, knowledge, learnings, emotions, fears, happiness, worries. I have done my best. However, I wish I had at that moment at least 50% of the knowledge I have today about pregnancy and newborns' health. So we will talk about today about fertilization, pregnancy, delivery, and these first and critical minutes of life, and urinary metabolomics and how it could help in understanding the neonatal health. Let's go to the very, very beginning. After the theory of spontaneous generation was abandoned in the 17th century, natural philosophers were able to see eggs. They postulated that one person exists inside the other within a woman's egg, similar to Russian nesting dolls. With the discovery of a microscope, the preformation theory surged. The egg was then considered as a passive receptacle waiting for the vigorous sperm. According to this theory, a preformed human being called homunculus was in the head of each sperm cell. This time coincides with the patriarchy era. Across the time, one of the main myths about fertilization was that millions of sperm were swimming on an Olympic race to desperately reach the egg. The fastest, the winner. This erroneous theory led to false message and misunderstanding of this complex process. Now, it is known that more than an Olympic race, this is a combination of complex movements, sperm capacitation inside the female tract, and chemotactant signals released by the eggs, which are of crucial importance in this process, which is more like to a challenging military obstacle course. Recognized as a non-passive receptacle, the female tract is essential not only for the elimination of pathogens contained in semen, but also for, sorry, I am hearing some sounds. The femoral tract is essential for the elimination of pathogens contained in semen, as well as for the elimination of sperm with physical abnormalities. And in fact, there are some recent studies showing that egg selection does not always match with partner selection. We must say also that stress will affect your eggs and your sperms. So everything begins before fertilization. It has been demonstrated that lifestyle, environmental stress, dietary factors, endocrine disruptors may induce epigenetic reprogramming both in egg and sperm. These alterations may be transmitted across generations. So if you are getting stressed, or if you are the F1 or F2 stressed generation because your mother or your grandmother was also stressed, keep calm and chill out. And then if you finally saw the fireworks, this is only the beginning. Fasten your seatbelt, please. Let's talk about pregnancy. Pregnancy is a complex biopsychosocial phenomenon. To a greater or a lesser degree, every expectant mother experiences frequent mood changes, which may be a potent stressor. Perinatal maternal stress can lead to different complications that may have far-reaching consequences for both somatic or psychic functioning of a newborn. As curious data, baby swallows more amniotic fluid if it tastes sweet. For the moment of birth, the baby's heart has beat around 54 million times. Neurotransmitters specific to pain processing appear between 10-14 weeks gestation. So your baby will experience pain immediately after delivery. Let's talk about maternal exposome. This is of pivotal importance. This is all that we can eat, drink, even we can breathe. For example, environmental pollutants, even if we are not aware of that. Together with our genome, proteome, transcriptome, metabolome, it will define the newborn phenotype. That is why several large and complex projects, as complex as you can imagine, like, for example, Element in Mexico and United States, or Athlete in the European Union, or the Canadian mother-child cohort in Canada, have studied the influence of environmental factors or exposome across generations. We could spend hours and hours talking about exposome during pregnancy. However, we will focus on particular points. Exposome is not only these molecules that we incorporate through foods, drinks, prescribed drugs, etc. Psychoexosome is a conjunction of factors that also affect the physiology at a molecular level. And this is essential during pregnancy because this is a vulnerable state and immunosuppression is well established. Some of these psychosocial factors are closely related with substance or drug abuse. For example, one of the most healthy drinks that we could consume during pregnancy, tea, as Claudia chose in the last week. There are some reports about harmful effects of consumption of tea, whatever kind of tea or of tea during pregnancy, because it depends on the content of caffeine or in the content even of pesticide traces, depending on the geographic area. So some reports have talked about risks of preterm delivery after consumption of tea, or some effects in neural tube development. But talking about alcohol. Prenatal alcohol exposure lead to maternal immune system activation and epigenetic modification through methylation and microRNA changes. This will cause alterations in the offspring immune system and neuroimmune system activation. Fetal alcohol spectrum disorder is a lifelong disability estimated in at least 4% of Canadians. Physical alterations, mainly located in the face, as well as cognitive, mental, and conductual changes characterize this syndrome. Another real and contemporary problem is the opioid consumption. This substance crosses the placenta, causing decreased regional brain volumes and alterations of white matter microstructure, as well as withdrawal symptoms in newborns and several immediate consequences, for example, reduced fetal growth, preterm labor, miscarriage, and stillbirth. However, long-term consequences have been also registered and documented as persistent alterations even in the adolescents. What is another problem of opioid, alcohol, and in general substance abuse? There is a correlation, as you can see in this table, between substance abuse and congenital syphilis. Syphilis is caused by the bacterium Treponema pallidum. And usually this is transmitted through sexual contact, vaginal, oral, or anal sex, but like gonorrhea, chlamydia, or HIV, syphilis can also be contracted from contaminated needle. Birth defects can occur in infants born to women who are infected with syphilis prior to or during pregnancy. In fact, in 2018, 10 times more syphilis infections were registered in Alberta in comparison with 2014. The proportion of women infected also increased, resulting in more infants, more newborns diagnosed with congenital syphilis. And vertical transmissions can occur anytime between 9 weeks gestation and birth. And you can see some of the short-term or long-term consequences of congenital syphilis. Canada sees a surge in congenital syphilis cases in last year, as well as the United States and also Mexico. This situation is common for most of the countries, principally in the last years. If you search about congenital syphilis and metabolomics, at least in PubMed, there is no report about some works performed with metabolomics to try to understand the physiological or physiopathological mechanisms behind this alteration and behind the long-term consequences. So if you cannot drink tea, if you cannot drink alcohol, if you even cannot breathe when the smoke is completely in the air, you can still listen to music because this has a beneficial effect in the pregnancy. In fact, some studies have reported that extensive prenatal exposure to a melody induce neural representation that lasts for several months, even after birth. So depending of all the factors mentioned above, how these factors acting together during preconception, fertilization, pregnancy, the expected moment is now here, the delivery. And depending on the effect of these factors and also on unexpected events during labor, for example, medical mistakes, a healthy or unhealthy newborn will be born. Over 90% of newborns will not experience problems in the transition to the extrauterine life. However, about 1% will require extensive resuscitative measures to survive in neonatal intensive care units. What happens in the first minutes of life? Well, the baby takes the first breath within about 10 seconds after delivery. In fact, active fetal breathing movements are present from 10 weeks of gestation to train the respiratory muscles in utero to be ready after birth. Reduce or even the elimination of these fetal breathing movements could be produced by the use of nicotine, alcohol, or opiates when are taken during pregnancy. The first inspiration is crucial for removing the amniotic fluid from lungs and for maintaining the adequate pressures that facilitates air distribution inside lungs. But together with respiratory adaptation, there are a large number of adaptations. We also can spend hours talking about these adaptations. But some of the most important include the change of fetal circulation, kidney function, and also thermoregulation. And why thermoregulation is so important? Because you know that the environment inside the utero is a warm environment. And after delivery, the baby will be exposed to low temperatures. These low temperatures will induce metabolic changes. For example, a higher oxygen consumption, a higher glucose utilization. It will release more lactic acid. If the process is not controlled or something wrong happened during the process, acidosis will be produced with a decrease of blood pH. And in some cases, there is also a diminution of surfactant production with a collapse of respiratory tract. So that is why the knowledge of metabolism at this stage is really, really important. Regarding metabolic alterations, there is a surprisingly lack of reference values from metabolites, both in the urine or blood during these first hours of life. We measured the urinary metabolome of healthy newborns in 2020 using a thymic prime assay. And as a result, together with a literature review, we added 378 neonatal urinary metabolites that are now publicly available via the HMDB and contribute to the last release of HMDB. Now, in 2023, why do not measure the urinary metabolome of unhealthy newborns? For this purpose, we collect urinary samples from 38 newborns admitted to neonatal intensive care unit. Why they were admitted there? Well, as you can see in the tables, some maternal conditions were present: preeclampsia, gestational diabetes, obesity, drug abuse, anemia, urinary infections, multiple pregnancies, and lately the infection with SARS-CoV-2. But you can see that all of these maternal conditions, most of them are as a consequence of exposome. And there are some other neonatal conditions that could be consequences from maternal conditions, but also from unexpected labor events, for example, cord events. These neonatal conditions are intrauterine pneumonia. In fact, some of the babies born to mothers infected with SARS-CoV-2 also had intrauterine pneumonia. Distress respiratory syndrome, hypoxic events, early onset sepsis, those characteristics were justifying the admission or the entry of neonates to intensive care units. Some visual signs or alarm signs about something is going wrong at the moment of delivery could be seen by the neonatologist. For example, unusual skin tone, the baby being silent and not crying, low heart rate, and these characteristics are represented by the APGAR, which means appearance, pulse, grimace, activity, and respiration, and usually is on a scale from 1 to 10. And neonatologists usually take decisions based on this scale. So when we compare these healthy newborns collected in 2020 versus the unhealthy newborns, we could say unhealthy because they were in the neonatal intensive care units, by means of TIMIC mega assay, we have seen that some metabolites are able to discriminate between both classes of newborns. And one of them is 3-deoxyglucosone. 3-deoxyglucosone induces reactive oxygen species, inactivates some enzymes that protect cells from reactive oxygen species, and also are involved in oxidative DNA damage. Another important event that could arise after birth is perinatal asphyxia. Perinatal asphyxia is due to maternal, placental, uterine, or cord events, as well as to intrapartum infection, for example, maternal fever during labor, as is common in SARS-CoV-2 infections. These babies usually must be resuscitated, intubated, and subject to therapeutic hypothermia in order to decrease the liberation or the release of toxic molecules that can cause irreversible damage to the brain. Usually these units are equipped with sophisticated instruments to monitor cardiovascular function, brain function, saturation of oxygen, also equipped with a cooling device just to put the newborn under lower temperatures. And that is why the use of biomarkers, molecular biomarkers, biosensors could be useful, because sometimes all these instruments are not available in all the hospitals. And in these first 6 hours of life, 6 hours, the baby must be transported to another hospital, meeting all the requirements for the treatment and for reducing or even saving their lives. But also another complication is preterm babies. Preterm babies born before 35 weeks, and they usually need also respiratory assistance, leading to bronchopulmonary dysplasia. This is a term used to define chronic lung disease in preterm infants as a result from oxygen and mechanical ventilation. This is a really, really serious problem, because once discharged from the neonatal unit, children with a BPD diagnosis are at high risk of rehospitalization due to higher susceptibility to viral infections, decreased nutritional state, or poorer neurological outcome. In fact, in one study evaluating 96 young adults from the NUNAPRE cohort, including adults with preterm story and BPD diagnosis, the study demonstrated that BPD group had, in the adulthood, more severe airway obstruction compared to preterm, asthmatic, or healthy groups. Because you can have a baby, which is preterm, but if you do not intubate this baby, or if you do not use oxygen supplementation for 20 days, 60 days, or sometimes 2 months after birth, the baby will not develop bronchopulmonary dysplasia. In our study, the clinical factors distinguishing between babies with BPD from the babies that doesn't have diagnosis of BPD were oxygen exposure time, intubation, respiratory distress syndrome, discharge with oxygen, and also low weight at the birth. Regarding metabolites, you can see several carnitines, acylcarnitines, amino acids, but inserting, you can see serotonin and 5-hydroxyl indolacetic acid. And why these metabolites are important? Because melatonin is a very important agent. It's a potent antioxidant, anti-inflammatory agent, and anti-apoptotic agent. But also metabolism provides a significant protection against brain damage in a neonatal model of hypoxia. So if you have a reduced level of serotonin, probably the melatonin synthesis could be impaired, and this represents a risk factor for having brain injury or brain damage. Regarding SARS-CoV-2 infection, in our study, we also saw that some babies with BPD diagnosis had IgG antibodies titers against SARS-CoV-2. And this is very important because there are some recent reports reporting that vertical transmission of SARS-CoV-2 is possible and seems to occur in a minority of cases of maternal SARS-CoV-2 infection in the 3rd trimester. The rates of infection are similar to those to other pathogens that cause congenital infections. In our study, none of the babies were positive to SARS-CoV-2. However, we demonstrate the presence of IgM or IgG antibody titers. So the placenta crossing for these antibodies was a real fact in these babies. And regarding metabolites, when we compare urine metabolites in SARS-CoV-2 or not SARS-CoV-2, IgG positive babies from babies that were not positive to antibodies, glucosa was increased and glutamine was decreased. And this is the same pattern that we have found in patients with active COVID-19 disease. So these are preliminary results. We are working on more analysis, but as conclusions from this talk, we can say that pregnancy is a complex process where genetic, environmental, conductual, and sociodemographic factors will drive the neonatal outcome. The sum of these factors, together with unexpected events at the moment of birth, will result in healthy neonates or neonates that must be assisted in neonatal intensive care units. And finally, remember, everything begins before fertilization. Thanks a lot, and I'm open to any question.
Thanks a lot, Yamile. This is a very, very nice presentation and very informative.